Hey, I'm Dr. Simone Gold. I'm a board-certified emergency physician, and I wanted to share with everybody my experience practicing emergency medicine in this era of the COVID-19 crisis. First, as we walk around, you can see that here at Cedars-Sinai Medical Center in Los Angeles, a big tertiary care medical center, it's really quite empty. The streets are empty, the parking lots are empty, the emergency department volume is down, the patient census is down, and that's really in most of the areas that I've been to and I've seen. This is not my hospital, but I'm just shooting here because it's such a famous place. So what I did for this little video is I asked my sons, who are teenagers, what kind of questions they had about the COVID-19 crisis, so I could be helpful to people who are in their teens and 20s. The first question my sons asked me is, when are we going to be able to get out and do things, and can we do that faster if we do the social distancing? So the answer is it really depends on the state. It's not up to the federal government. The federal government gave it back to the states, so each state is different. So it's your governor and sometimes your mayors who are determining when you can get out and about. I do think that if you take your social distancing practices that you've learned over the last month or two into the workplace and into the social environment, that would be a very helpful thing. That's going to help our governors and mayors help us open up the economy and get you all back to regular life. Next question was, how effective have we been at flattening the curve? Because everybody's heard this expression about flattening the curve, so my sons would like to know, have we done that? And the answer is most definitely. The concept of flattening the curve was so that we didn't overwhelm our healthcare system, right? We didn't overwhelm the doctors in the hospitals and people like me on the front lines seeing too many critical patients all at the same time. That was really the problem with COVID-19 from the beginning. Well, it turns out, as you can see from what I showed you, we've absolutely done that. Hospitals are actually operating at very low capacity at the moment. I know that my work as an emergency physician, we have many less patients than I normally have, and that's really true pretty much across the board, except in, like New York obviously had, a very big problem for peak, etc. But really all over the country, hospitals are quite empty. So we have been very successful at flattening the curve, and remember, that's the reason we shut down the economy. So if you are on board with that, then you should also probably be on board with considering opening it up. And the other thing about the social distancing and flattening the curve is you have to just remember also that different places have done it differently. So California does it differently than Florida, for example. Because his next question was, how effective has this social distancing been? And I would say that until we know, by looking at all the data, at places that did the lockdowns later and places that did the lockdowns earlier or places that didn't do lockdowns at all, we won't be able to quantify and say with precision how effective all these measures have been. But there's no question that the disease is highly contagious between people. So what I would say is we take all those good practices that we've done for the last month or two and just kind of carry them forward going into the future. The next question was, how effective is this drug that he's hearing about? So obviously most people don't really know the name of the drug. It's called hydroxychloroquine, and it's a drug that's been around for a really, really long time. And I was very sorry as a physician to see it become so politicized. But I knew about the medicine, I knew about its potential usefulness in this illness before it ever became politicized. And before it became politicized, I thought it was fantastic. I mean, this is a drug that has been FDA approved for 65 years. There's been hundreds of millions of dosages given in all that time. It's considered the safest category of drugs. We give it to pregnant women, we give it to breastfeeding women. It's generic, it's cheap, it's widely available. It can be scaled up to large dosages very fast. So at this whole outset of the COVID-19, if somebody had said to me, wow, we've got this generic drug that may be helpful and we can scale it up really quickly, I thought everybody would be like, that's terrific, that's fantastic. And unfortunately it became very politicized. But the data that we have now, although incomplete, it's either promising, seems likely to be effective, or they just kind of can't say. My own opinion, having read everything I could on the subject, is that it really is quite promising, especially when we give it earlier. And it's important to note that it became so politicized here. And in other countries, they didn't take this approach. So for example, in the country of India, it's given as prophylactic really to all healthcare workers. That's really their national policy. So I'm just sorry that it's been politicized here. And time will tell about the data, but my opinion, having read everything out there, is that it is quite helpful, especially in the beginning. And the last question that my kids were asking me is, is all this lockdown, is it legal? Is it constitutional? We're complying and everything, but, exactly where does this fall? Because he had seen a video of somebody paddleboarding out in the ocean by himself, and that person was actually cited and either arrested or just cited and fined, and he wanted to know what I thought about that. So the answer is, you know, even in the middle of a crisis, our constitutional rights still exist. We still have a right to the First Amendment, Second Amendment, and all those rights. Right to assemble, the right to free speech, the right to practice our religion as we see fit. Those rights do not go away just because there's some kind of crisis going on. That's very established in constitutional law. The government has to do these things as narrowly as possible while maintaining our rights. So the good news is that I believe all the lockdowns will be, you know, gradually lifted soon, and hopefully we won't face these questions. But I think going forward, we really have to keep an eye on making sure that our civil liberties are not abrogated, as we've seen them happen in some states. So I look forward to the government opening up our city wide, because as you can see, the curve has been flattened.